Welcome to the deep dive. Today, we're going to be tackling a question that you had about a possible link between a mother's diabetes and autism risk for her children.
Yeah.
You sent over some really interesting research, including pieces from the Kennedy Krieger Institute and a scientific review on prenatal metabolism and neurodevelopment.
Wow.
So buckle up because we're going to untangle what this research really says and what it might mean for you.
It's striking that we're seeing this parallel rise in both diabetes and autism rates.
Right.
It really begs the question, could there be a connection?
Yeah.
It's not just a coincidence that we're talking about this.
Exactly. And the Kennedy Krieger article highlights just how many people this could potentially impact,
Mhm.
stating that gestational diabetes, the type that develops during pregnancy, affects a significant number of expectant mothers.
And to understand why that's so significant, we need to think about what's happening during those early stages of pregnancy.
Yeah.
We're talking about the formation of the neural tube, the very foundation of the baby's nervous system.
Yeah.
Disruptions during this critical period can have a ripple effect, impacting brain development in some really profound ways.
That makes a lot of sense.
Yeah.
So the timing of a diabetes diagnosis during pregnancy seems particularly crucial here.
Absolutely.
Yeah.
The research we're looking at focuses primarily on gestational diabetes, but also touches on type 1 and type 2.
Okay.
The key takeaway is that the risk appears to be most pronounced when gestational diabetes is diagnosed early, specifically by 26 weeks.
Okay, so let's talk about those risk factors for gestational diabetes.
Sure.
The Kennedy Krieger article lists several, some within a person's control and others not so much, right?
Right. Things like family history, age, and even race and ethnicity can play a role.
Oh, wow.
For example, the risk of developing gestational diabetes increases steadily for women over 25.
Okay.
And certain racial and ethnic groups in the U.S. have higher rates.
So while some risk factors might be unavoidable, understanding them can help with planning and possibly even early intervention.
Exactly. Even if you have a family history of diabetes or fall into a higher risk demographic, there are things you can do to manage those risks.
Okay.
Maintaining a healthy weight before pregnancy and making healthy lifestyle choices can make a significant difference.
Now let's dive into the heart of the matter, the link between diabetes and autism.
Okay.
What's the science telling us?
Well, we have this large-scale study from Kaiser Permanente.
Okay.
They found that gestational diabetes, diagnosed by that 26-week mark, was linked to a 42% increased risk of autism.
Wow.
Interestingly, type 2 diabetes, or gestational diabetes, diagnosed later in pregnancy, didn't show the same association.
That's a pretty significant finding, especially considering the size and scope of that study.
It really highlights the importance of early detection and management of gestational diabetes.
The Kennedy Krieger article also includes a table of recent studies, and one detail really caught my eye. There's an Israeli study that found children of mothers with gestational diabetes had a higher risk of things like eating disorders and sleep apnea, in addition to autism.
That's where it gets really intriguing. It suggests that gestational diabetes might not be specifically targeting autism, but rather impacting brain development in a broader sense.
So it's less about a direct cause and effect relationship and more about a vulnerability to a wider range of developmental challenges.
Precisely.
Okay.
This Israeli study suggests that gestational diabetes might create a kind of vulnerability in the developing brain,
Right.
making it susceptible to a range of neurodevelopmental issues.
And to add to that, there's a meta-analysis mentioned, a review of 12 studies which found a significant association between maternal diabetes and autism risk, lending even more weight to this connection.
Right. It's not just one isolated study. We're seeing a pattern emerge across multiple research efforts.
Yeah,
But remember, we're talking about risk factors, not guarantees.
absolutely. It's about understanding those risks and taking steps to minimize them where possible.
Exactly.
Yeah.
And to do that, we need to understand the how, the mechanisms by which diabetes might be impacting brain development.
And that's where the scientific review you set comes in. They discuss several potential mechanisms, starting with hyperglycemia or high blood sugar.
Yes, and this is key.
Okay.
Think of it this way. Excess sugar can be toxic to the developing brain, almost like disrupting a delicate recipe.
Right.
And it's not just the sugar itself. The body's response to that high blood sugar also plays a role.
So the body's trying to deal with this excess glucose, and that process itself can have negative consequences.
Exactly. The scientific review highlights how both high blood sugar and excess body fat, often linked to diabetes, can trigger inflammation.
Oh,
And that inflammation can be harmful to the developing fetus, potentially impacting brain development.
that makes sense. It's like a cascade of effects stemming from this initial metabolic imbalance.
Exactly. And the review goes on to discuss two other important mechanisms: reduced oxygen supply to the fetus and something called oxidative stress.
Okay, let's break those down.
Yeah.
First, how does diabetes affect oxygen supply?
Well, a developing baby needs a steady and sufficient supply of oxygen to thrive, especially for brain development.
Right.
Diabetes can interfere with that oxygen delivery,
Right.
potentially hindering those crucial processes.
And then there's this oxidative stress.
Yes.
Can you explain that in a way that makes sense even for someone who's not a scientist?
Imagine your cells are like apples.
Okay.
Free radicals are like tiny bites taken out of those apples,
Yeah.
causing them to brown and decay.
Got it.
Antioxidants act like lemon juice, preventing that browning and protecting the apple.
Okay.
Diabetes disrupts this delicate balance, leading to more bites from those free radicals and less lemon juice protection from antioxidants.
Right.
This can damage cells in the developing brain, potentially contributing to neurodevelopmental issues.
So we're seeing that diabetes during pregnancy, especially if not well managed, can create a sort of perfect storm for the developing brain.
Yes, and the research is really starting to paint a clearer picture of how interconnected things are. It's not just about one single factor, but rather this complex web of metabolic imbalances and their potential consequences.
It can feel overwhelming when you start digging into all of this research.
Yeah.
That's why we're doing this deep dive, right? To break it down and figure out what it all means for you, the listener.
Exactly. And while the science might sound complicated, the good news is there are things you can do to minimize these risks.
Let's talk about that. What are some actionable steps people can take?
Well, first and foremost, knowledge is power.
Yeah.
Now that you're aware of these potential links between maternal diabetes and neurodevelopmental risks, you can start making informed decisions.
So for someone who's thinking about starting a family, what would be the first step?
If you're planning a pregnancy, getting tested for diabetes and taking steps to manage any risk factors within your control is a great place to start.
Things like maintaining a healthy weight, eating a balanced diet, and exercising regularly.
Exactly. Those lifestyle choices can have a significant impact on your overall health and can reduce your risk of developing gestational diabetes. And of course, if you have a family history of diabetes or other risk factors, working closely with your doctor is essential.
And what about once someone is pregnant? What role does prenatal care play in all of this?
Prenatal care is absolutely critical. Early and consistent prenatal care allows your healthcare provider to monitor your blood sugar levels, offer guidance on nutrition, and address any concerns that arise. Early diagnosis and management of gestational diabetes can make a huge difference in mitigating those potential risks.
Now, I know we also wanted to touch on the role of prenatal vitamins or PNVs.
Yeah.
There's been some debate about their effectiveness and even potential risks, right?
Yes, the research on PNVs is a bit of a mixed bag. Some studies suggest that PNV use, particularly early in pregnancy, may have a protective effect against autism, but other studies indicate a more complex relationship where both low A&D high intake of certain vitamins might be problematic.
That BBC study we talked about earlier found that both infrequent A&D, very frequent multivitamin use, was linked to higher ASD risk. It's enough to make your head spin.
I know it can be confusing. It seems likely that the optimal approach to PNVs varies from person to person, perhaps depending on individual needs, genetic factors, or even the specific composition of the PNV.
So it's not as simple as just taking a prenatal vitamin and assuming everything is covered.
Right. It's crucial to have a conversation with your doctor about the right type and dosage of prenatal vitamins for your specific situation. They can help you navigate those complexities and make the best choices for your health and the health of your baby.
What I find really fascinating is this idea that PNVs might be able to counteract the negative effects of harmful environmental exposures. Is there any science to back that up?
There's definitely a growing body of research exploring this connection. Some studies have shown that adequate folic acid intake, often through PNVs, might mitigate the effects of pesticide exposure and air pollution on autism risk. It's a very promising area of research, and one that could have significant implications for public health.
So if we're thinking about minimizing risks, it sounds like it's a multifaceted approach. It's not just about managing diabetes, but also considering things like environmental exposures and the role of nutrition through things like prenatal vitamins.
Exactly. It's about taking a holistic view of health and recognizing that all these factors are interconnected. There's no one magic bullet. But by addressing these different aspects, we can create a more supportive environment for healthy pregnancies and optimal child development.
So we've covered a lot of ground here. from the rising rates of both diabetes and autism to the potential mechanisms linking the two and the steps people can take to minimize risks. Before we wrap up, I wanted to leave our listener with one final thought-provoking question. If gestational diabetes is a temporary condition disappearing after childbirth, why might its effects on a developing brain be long-lasting?
That's a great question, and one that really highlights the profound importance of those early stages of brain development.
It's a lot to think about, but I feel like this deep dive has really highlighted the incredible complexity of brain development. And maybe even more importantly, it's underscored how much we still don't know.
Absolutely. And I think this conversation also emphasizes a crucial point, the potential for individual variation.
Right.
Not everyone exposed to the same risk factors will experience the same outcomes.
Right.
Genetics, other environmental influences, even chance can all play a role.
That's a really good point. These studies provide valuable information about risk, but they can't predict the future for any one person.
Right. And that's where the concept of personalized medicine becomes so important.
Yeah.
As our understanding of these complex interactions deepens, we may be able to tailor interventions and preventative measures to individual needs and circumstances.
So as we wrap up this deep dive, what are some key takeaways you'd want our listener to walk away with?
I think the biggest takeaway is this: knowledge is power.
Mm,
We've unpacked this potential link between maternal diabetes and autism risk,
right.
explored some of the mechanisms involved,
Okay.
and highlighted steps people can take to mitigate those risks.
Yeah.
This information empowers individuals to make informed decisions about their health and family planning.
If someone is thinking about starting a family, getting tested for diabetes and understanding their risk factors is a proactive step they can take. And managing those controllable risk factors, like weight and lifestyle choices, is also crucial.
And once someone is pregnant early and consistent, prenatal care becomes absolutely vital. A healthcare provider can monitor blood sugar levels, offer guidance on nutrition, and address any concerns that might come up.
We've also learned that the research on prenatal vitamins is still evolving. While they might offer some benefits, it's important to talk with a doctor about the right type and dosage for each individual situation.
Remember, there's no one-size-fits-all approach to pregnancy and child development. What works for one person might not work for another.
As we close out this exploration, we encourage you to keep learning, ask questions, and advocate for your own health and the well-being of your future children.
Parenthood is full of complexities and unknowns, but by staying informed and proactive, you can face those challenges with confidence and create the best possible environment for your family to thrive.
Thanks for joining us on this deep dive. Until next time, stay curious and keep learning.